We'll go ahead and get started here in just a minute. Dr. Julie Watson will be the one that will kick us off. If you are not speaking, if you don't mind putting your microphone on mute.
Maggie, can you guys hear me okay? I don't know if my speakers and my microphone are where they need to be.
I hear you okay.
Sure, my phone is on silent. Maggie, tell me when you're ready.
Go ahead and start. Looks like we have a good participant right now.
Okay. All right. Let me get this down here if I can. Okay. Hello, and thank you for joining us virtually this morning. My name is Dr. Julie Watson. That's JULIEWATSON. I am the Chief Medical Officer at Integris Health. I'm joining you today with three of my counterparts and colleagues, Dr. Dale Bratzler, Chief COVID Officer at OU Health, Dr. Chad Smith, Chief Medical Officer at Mercy Hospital, and Dr. Kersey Winfrey, Chief Medical Officer at SSM St. Anthony. As we have done twice before, as your Chief Medical Officers and physician leaders for 4 major health systems in Oklahoma City, we'd like to share with you what we are experiencing in our hospitals during this third COVID surge, what we know about this variant, and what hopefully we can do together. Our emergency departments are overflowing. Our healthcare professionals are exhausted. We have been working nearly nonstop for over 2 years now. Omicron cases are rising faster than previous variants, and we are struggling to keep up. We have 0 ICU beds and no inpatient beds available in Oklahoma City. This morning, all of our health systems across the Oklahoma City metro had a total of 117 patients in our emergency departments waiting for an open bed. We are trying to adapt as best we can, and here's the hard truth. Despite our best efforts, we may not be able to provide care as we normally would. Between our 4 health systems, there are hundreds, and we estimate over 1,000 coworkers in quarantine or unable to come to work due to kids out of school and no available childcare. Just like our teachers and airline crews, we are experiencing staffing shortages that impact our everyday. This has nearly crippled our already limited staff. We are at times seeing more patients to one nurse or one doctor than we would have ever designed. We also have supply chain shortages. Some days we don't have syringes or saline or chest tube setups. But what this really means for us and for you is that we aren't able to care for patients the way we normally do. This is not the care we are trained to provide. And this time it feels and sometimes even looks like a war zone. Cases have risen so rapidly, we have to care for patients in hallways, sometimes closets. Patients have been waiting more than 24 hours for an ICU bed to open. We can't accept patients from rural hospitals whose patients need us. They need our doctors, our clinicians, and they can't come. We are telling you this because you need to know this is not our choice. This is not what we want. We've canceled surgeries. We pulled in our own workers from non-clinical areas to clean your rooms, to deliver trays, to open supplies on our loading docks. And we are still struggling. We can't cancel flights and we can't go remote. Our doors are open 24 hours a day. There is no rest for the weary. That's why I'd like to take a moment to talk to our healthcare workers right now. Please know that we see you and we are doing everything within our power to help you survive this nightmarish roller coaster. You've been asked to be heroes for too long. You're human beings who have shown superhuman strength, and we know you're battered and scarred. We know that violence against healthcare workers is on the rise, and you're facing challenges in your own lives, and you're still showing up to take care of patients and families every day, whether you are in the ER or a clinic or cleaning rooms or answering phones or keeping our systems running. You are the heart and soul of our organizations, and you are valued. Thank you. Oklahomans, what I will ask of you is this. Please work with us until we are on the other side of this surge. Of course, we want you to get vaccinated and boosted because we know you'll recover more quickly and you likely won't require hospital care if you get COVID. And we want you to seek care if you need it, because that's what we are here for. But we also need your grace and patience while we struggle to provide the best possible care under near impossible circumstances until this surge is over. We will get through this. Let's treat each other kindly, despite all of the pressures that we all live with every day. Let us be kind to one another. We are wounded ourselves. I will turn it over to Dr. Dale Bratzler, the Chief COVID Officer at OU Health.
Thank you, Julie, for those comments. I want to just make a few about the state of the pandemic in Oklahoma right now. I noted this morning that in the past week, Oklahoma has gone from 47th in the nation for number of new cases per day. As of yesterday, we were up to 13th in the nation. So the surge has clearly moved into Oklahoma, and I think we're a good week to 10 days behind the East Coast. So I do expect cases to continue to go up. I would point out that the health department just released numbers, and there were just under 4,000 cases reported today, but I caution you to be skeptical of the number that comes out on Tuesday, which often reflects some of the reduced testing that's happening on the weekends. So I'm not sure that today's number is reflective of what we will really see. Across the state, cases are way up. I was on a call with a colleague from a rural hospital yesterday that had spent time calling 5 hospitals in 5 different states, trying to find an ICU bed for a patient with kidney failure, and subsequently did not before the patient succumbed to the disease, who had COVID and kidney failure because of that. We have a population in Oklahoma that's at high risk of complications of this disease. So as Dr. Watson mentioned, we want you to be vaccinated, and if you're eligible for a booster, certainly do that, because that risk of complications and hospitalization go down clearly if you've done those things. But even though you've been fully vaccinated, some people are testing positive. The good news is that most of those people will do well from this disease. Remember that there are certain risk factors we know that put you at high risk of the complications of this disease. Age is the most important, but being immunosuppressed, having diseases like diabetes, kidney disease, liver disease, cardiac disease, pulmonary disease, and chronic liver disease are the known risk factors for complications of this disease, even if you're fully vaccinated. So think about the people who are around you and practice those mitigation strategies that we've talked about so much, of wearing a mask in public places, trying to avoid indoor crowds at this point in time. And certainly, if somebody is positive or has symptoms, please stay home. Don't go into public and transmit the disease to others. Just a couple of comments about where we're at with COVID with OU Health. We too are full. We have no ICU beds available. I was informed this morning that we have the highest number of COVID patients in the Children's Hospital, which includes pediatrics and women's services, that we've ever had throughout the entire pandemic. About 4% of our workforce are currently out on quarantine or isolation. So we too are struggling to meet the staffing needs. Again, if you need to be in an emergency room, I encourage you to go to the emergency room, because all of our systems, we will take care of you if you have an emergency. But if you don't have an emergency, please avoid using the emergency room right now. Just recognize that there are patients laying in the emergency departments waiting to move into beds across the city. So again, I want to reiterate one more point that Dr. Watson made, and that is we have to thank the healthcare workers, the frontline staff, the therapists, the nurses, and others that are in the face of this disease every day. They are the true heroes right now. So I'm going to turn my time over now to Dr. Chad Smith, the Chief Medical Officer for Mercy, Oklahoma City.
Thank you, Dr. Watson, and thank you, Dr. Bratzler, and thank you for everyone on this meeting. So an update from Mercy Hospital, Oklahoma City. Today, we're caring for 102 patients with COVID. We have 0 ICU beds available. We have 0 step-down beds available. And currently, we have 9 patients waiting in our emergency department for one of those open bed spaces. This Omicron surge has been particularly challenging for our emergency departments. We've seen a record number of patients in our ERs over the last few weeks, more than any other time in the pandemic. Our waiting rooms stay full. There are often patients boarding in hallways or overflowing in triage areas. Some days we have patients on ventilators in the emergency department until we can find an open room in the ICU. This creates a bottleneck at all of our hospitals. Care is delayed because many times there's just simply nowhere for patients to go. Many people are walking into our emergency departments looking for a COVID test, even when they don't have symptoms of severe illness. If you have minor COVID symptoms, or if you've been exposed, you can help us all by seeking testing at a more appropriate location, such as your primary care office or one of the many public drive-through testing locations across the metro area. We are grateful for partners like the State Department of Health, the Oklahoma City County Health Department, and ME Labs, who have created so many more access points for people across the region. Please come see us if you're having a true emergency. We are still here. We want to be able to take care of you in a timely manner when you feel like you can't breathe, you're experiencing shortness of breath, or you feel you're at high risk for severe illness. That's what our ERs are for. However, clogging up our ERs with minor illnesses that could be seen in an urgent care or primary care setting, or even treated at home, is what is exacerbating an already extremely challenging situation for our patients and coworkers. Finally, if I may speak up for our coworkers, they are tired. They're worn out, but they continue to show up every day. Many of us went into healthcare because we felt called to serve and care for others, to be a part of healing patients. This surge seems to be particularly challenging on all of our nurses and caregivers, especially those in the emergency department. It is very difficult to show up to work every day and continue to see a packed emergency room waiting area. It is even more disheartening to see some of the same patients you saw at your previous shift still boarded in the emergency room, waiting for a room to open up. Coworkers are dealing with the same life stressors as everyone else is right now. Their kids are out of school, or they are managing virtual school, as well as potentially taking care of sick family members at home. Kindness, compassion, and decency towards each other are needed now more than ever. Patients are angry about long wait times and often take their frustration out on our coworkers. Please know our coworkers share that same frustration. No one wants to keep patients waiting for care. We want to get them seen as quickly and as safely as possible. but this is the reality of the current overwhelming surge that is out of our control. Our coworkers are doing the best they can. I'd now like to pass it over to Dr. Winfrey, who's the Chief Medical Officer at SSM Health. Thank you.
Good morning, and thank you for this opportunity. I'm Dr. Kersey Winfrey, Regional Vice President for SSM Health St. Anthony. I serve as our organization's Regional Chief Medical Officer. I appreciate the time to report on this. You may have heard the Omicron variant is mild. If you or someone you know has recovered from the virus with minimal hardship, we are very glad to hear it. However, if you were standing in any one of our overflowing emergency rooms or ICUs, you would see the impact of this highly contagious virus on our health system as anything but mild. Once again, as we've seen with prior surges, the only way we can flatten this curve is through proven mitigation techniques. This is a preventable tragedy. Make no mistake, we need your help. In fact, you and only you can bring this crisis to an end. You've heard some of this before, but today's COVID hospitalization numbers are unprecedented. They underscore the extremely important prevention measures that bear repeating. We know that you must get vaccinated, and when the time is right, get your booster. History has proven time and time again, vaccines save lives. Wear a mask when outside your home or vehicle, regardless of vaccination status. Watch your distance, wash your hands. Ask for direction from your public or primary health care providers before going to the emergency rooms or urgent cares. They are busy taking care of people with extreme needs. They have numerous holds in the EDs. They're operating hospitals in our emergency rooms. We are sounding the alarm. As Dr. Bratzler described a few moments ago, the Omicron variant is aggressive and highly contagious. If you lead an organization, or even if you are making decisions for yourself and your family, now is the time to take action. Now is the time you can make a preventive difference for yourself, your families, your coworkers, and our precious frontline nurses, doctors, and health systems. Here's what we need you to do. Require masks in group settings. Postpone non-essential events and social gatherings until case numbers have been down for at least 2 weeks. If possible, work from home. If that's not feasible, try to make as much communication as possible virtual, avoiding in-person meetings and break room gatherings. We have wonderful technology at our disposal. Let us use it. This one is important. If you feel sick or have been exposed to someone known or suspected to have COVID, stay home and get a test. Testing, thanks to public and private partnerships like the Oklahoma State Health Department and ME Labs, are now widely available. My colleagues here today have emphasized that working in the prolonged crisis state of the COVID-19 pandemic brings resource challenges that sometimes feel insurmountable, especially when it comes to human resources like our caregivers and support staff. It's challenging for Oklahomans from all walks of life, and we thank everyone who has done their part anyway to keep our communities safe. Those who have gotten vaccinated, worn masks, followed CDC guidelines, and made personal sacrifices, we see you and appreciate you. Make no mistake, while you may feel that Omicron variants are mild and dismissible, now is the time to realize that you couldn't be further from the truth. We are here today to sound an alarm. It is spreading rapidly, making many people with chronic illnesses sicker and disrupting our communities as well as our healthcare workforce, with infections among our employees and their families. Thank you. Now we look forward to hearing your questions.
So thank you, Dr. Winfrey. Thank you, Dr. Smith and Dr. Bratzler. We hope that you walk away from this press conference with a better understanding of what we are experiencing, what is happening within our hospital walls, within healthcare, and frankly, what we can do together to survive this surge. I'd like to open it up now for questions.
Hi, Andy Weber with KOCO5 here. A quick question for you, for any of the physicians. With the seriousness of what we're seeing at our hospitals, at what point, like other states, do we bring in, or have you considered bringing in, asking for National Guard?
So I'm happy to speak to that, and then we'll open it up to my colleagues. In fact, the chief medical officers here in the Metro have a very good relationship with Interim Commissioner of Health, Keith Reed. We've had these conversations before. unfortunately, deploying National Guard is not as certain. No one thinks it's easy, but it is not as easy as it sounds. And often the places that we need them, for instance, in patient transport and things like that, those National Guardsmen are already deployed in medical spaces. So it's almost robbing Peter to pay Paul. But those conversations, absolutely, we have visited those conversations to find out what national and what state resources are out there. Those conversations feel like they are happening on a continual basis, to be honest with you. There really isn't an easy button. We would have pushed it if there were, of course, and everyone wants this to be over as soon as possible. But that is why there's really a plea to Oklahomans. I truly believe we've got a lot of folks trying to help us out as much as we can. And we needed to get back in front of the community to say, please be patient when you come to our facilities. Please use the testing locations that are not in the ER, and please get vaccinated. Please get boosted.
Julie, there's a question, or sorry, Dr. Watson, there's a question from Dana Branham. I think I said that correctly.
Thank you, Maggie. My question for the health leaders would just be, you all have been really clear about what individuals can do to ease the strain on the systems, but at the state or local government level, what can those leaders be doing to help assist you all?
Would one of my colleagues like to answer first?
Well, I'll start. I mean, I think we have highlighted the things that need to happen. Right now, we're in the thick of this particular surge, so encouraging people to wear masks diligently. We're recommending now that people upgrade their mask, use medical grade mask. You can buy surgical masks very inexpensively, many different places. So wearing masks, wearing high grade masks, avoiding those indoor settings. We just need the messaging to be consistent across the state. Avoid indoor settings where there are large groups of people, particularly in poorly ventilated spaces. Get vaccinated. That may not help immediately, but it will help bring down the surge down the road. And if you're not vaccinated, or if you're eligible for a booster, please seek that out. That's just really, really important right now. And then, as all of us have mentioned, please don't go to the emergency room unless you have a true emergency. Don't go for a test or other things, because right now that's the entry point for many people in our hospitals, and the emergency rooms are really clogged up right now. So we need consistent messaging. I think that's one of the most important things.
I agree, Dana. I think partnering with our public health officials, our state government officials, as much as we can, be on point with the same message that always, we believe, makes a difference. We have consistently, asked our state public health officials for help with monoclonals. We know that really there's one remaining monoclonal that is the most effective against Omicron, and I believe that they are doing everything that they can to allocate that fairly across the state. We know that the manufacturer of that one monoclonal, it just cannot simply keep up with the demand, and that we're getting as much, we believe we're getting as much as we can. Of course, as was mentioned earlier, the state has also partnered with ME Labs to expand testing across the state and to try to keep those turnaround times as quick as possible. We've been able to benefit from the expansion of that partnership on really dispersed throughout at least the metro. And we have escalated our supply chain concerns. And so we continue to have those dialogues, that dialogue, really on a weekly basis.
So briefly, I would just echo what's already been said. I believe it's very important for our state leadership to align with us in our messaging. People are very anxious. A lot of the anxiety about potential danger to themselves, their loved ones, coworkers, can be, I think, addressed and reassured whenever we're aligned in our messaging. The actual messages that we currently are trying to share could be made louder with the right amount of alignment from state leadership.
Thank you. And I have just one other question, if that's all right. I know in the open letter that you all shared last night, you said that soon, if you get in a car wreck or have a stroke, that the help that you need might not be available to you at some point in the future. And so how far away are we from that point?
I would answer that by hard to determine specifically. I think to some degree, all of us are challenged with that right now, meaning we all keep track of requests for transfers to our facilities from our rural communities, even from outside of the state, and frankly, from within the metro area. And what we're seeing is that on a periodic basis, and unfortunately it's more frequently than not, we're not able to accept a number of transfers because we just don't have the capacity to see those extra patients. So to some degree, that's already occurring. When that gets to a point of it's always that way, I think that's going to be hard to determine, and it'll frankly be one of those situations we'll realize it when we're in there. But I would submit that we're really close on a day-to-day basis. We're challenged with trying to meet all the needs and demands of our community.
If there's nothing to add to that, there's another question from Reese Gorman.
Hi, yeah, thank y'all so much for hosting this, and for putting this on. My first question is just, obviously we've seen some bills passed in last session that hindered the mitigation efforts that universities, schools, municipalities can put on to hinder COVID-19 and hinder the spread of it. How much of that has that hurt the mitigation process of COVID-19 and kind of help lead to where we are now with cases rising and all that?
I don't know that I can quantify in any way what the impact of some of the restrictions have meant. I would simply say, you know, there are now many studies that have demonstrated clearly that mask policies in schools or in communities reduce transmission rates for COVID-19. That's actually not controversial anymore. It's quite clear when people do it consistently. I will point out that one of the challenges we have in healthcare right now is I think most of our healthcare employees are quite safe when they're in our systems because we have strong policies in place around wearing masks and hygiene and other things to try to prevent the spread of the disease. But all of our healthcare workers have lives outside of our health systems where there is the risk of possibly being infected. We know in our schools, certainly what we found here in the Health Sciences Center is that I don't think we actually protect our students by sending them home because I think they're safer here on our campus where we have very strict policies around mitigation strategies like wearing masks that keep them from getting infected. But again, we can't control what anybody does outside of our institutions. And if you go out into public places, if you're around other people, you increase the risk that you could get infected. So that's part of the big challenge right now. You have to be consistent about these practices of wearing masks, doing hand hygiene, you know, trying to avoid crowds of other people.
Dr. Braxler's point, I'd say that Omicron has been a test for us, a true test in what we've learned from the past. And I just regret to say that we're not really doing very well in that test, and because of all the inconsistencies in how we message about what we know works.
Yeah, I'm gonna chime in and answer a little bit of Reese's questions too. This is Cameron Matra. I'm the CMO for OU Health, and also the physician executive for Children's Hospital. I think your question is great. What I can tell you is that what we're seeing today over the past 2 weeks is so different than we've seen over the past 2 years from a children's perspective in what's happening. Dale mentioned this morning that our numbers at children are 42 COVID patients in the Children's Hospital. That's 2 to 3 times higher than we've ever seen. That does include women's, but there are upwards of 30 kids in the hospital, and about 6 or 7 of those are in the ICU. The other thing that we're noticing is on a daily basis, we are restricting our OR cases because of what you've heard about. But at the same time, we used to have maybe 1 patient or 2 patients test positive, and so we would cancel their cases. Yesterday it was 10. Today it was 6 or 7. So we're seeing many more kids test positive and canceling cases because of that. When we look at our pre-testing area, for the past several months, the percentage of kids that have tested positive who are coming in to have an operation was about between 1 and 1.5%. The past 2 weeks, it's up to 13%. It is a huge increase in the number of kids, and so that tells me that they're getting it at school, they're getting it at home, and although we aren't allowed to, or school districts, I would say, aren't allowed to mandate any type of thing. I will tell you that every time I talk to you all about what can we do to protect our kids, there's nothing wrong with a parent asking their child to wear a mask when they go to school, and I think we need to continue to do that. So thank you.
Definitely. And just one other question, kind of on that note, what is, obviously we're seeing you just mentioned seeing a big difference of children are getting infected with Omicron at higher rates than what they were previous variants. What is the vaccinated to unvaccinated kind of ratio in y'all's hospitals right now in regards to COVID-19?
For pediatric patients or all patients?
All patients.
So I can speak on just what we know about Mercy patients. So of the patients that we have at Mercy, it's approximately 58% of those patients have had no vaccination or partial vaccination. And then we're seeing an additional 25-ish to 28% of patients that have received just the primary booster, whereas only 7% of our inpatient population has had the primary series and the booster, which is fairly consistent with the latest information from the literature that says that those that have been vaccinated with the primary series and have had their booster, the efficacy against Omicron is roughly 88%.
I know Dr. Bratzler can speak to this, but we have a few ways of looking at that. We obviously look day to day. For us at Integris Health, usually the percentage of unvaccinated is 75 to 80% or so across medical surgical beds versus ICU beds. What we're seeing is, I believe it's something about 15% of patients in our ICUs right now with COVID are vaccinated. And what can be hard to tease out is that when you take all comers, med surg, and ICU, we're admitting patients for other reasons who are incidentally testing positive for COVID. So they're not really coming in for COVID care, but they certainly require the resources and have to go to the same type of isolation units as patients who are actually there to be treated for their COVID symptoms or COVID illness. And so the numbers are difficult to tease out. And I think that's important for the community to understand. It's easy we've all lived with the colossal misinformation that is out there, particularly on social media. And this is ripe for that. And I'd like the community to hear us when we say, if you're saying, well, 25 or 30 patients in the, percent of patients in the hospital are vaccinated, so vaccines don't work. That's not the case. Some of those patients are incidentally testing positive. And I can tell you right now, last week we had no ICU patients who were COVID positive that were vaccinated, none that were fully vaccinated. And so vaccines do work and they prevent serious illness. And if you are vaccinated but not boosted, please get boosted. It is a game changer for you and for preventing serious illness.
I'll just add one point. And so about a third of our patients in our adult hospital right now are COVID positive, but we've seen a lot of COVID positivity in our trauma patients who clearly didn't come here because of COVID. They get admitted through our trauma unit, but they test positive for COVID. So those patients may or may not have been vaccinated, and COVID is not what put them in the hospital. It's their car accident or other trauma events that are bringing them in. So we're seeing a lot of that. It's as I told others, it's not black and white about whether or not somebody that's in the hospital that has a positive COVID test is there because of COVID or has it incidentally because of some other serious illness.
I'm going to pass it on to, it looks like, is it Trey Savage had a question?
Yes, thank you so much. Trace, actually, but no big deal. We're hearing about essentially an emergency situation in the emergency rooms in Oklahoma City. And from my understanding, a legal standpoint, an actual declaration of emergency, either by the state or by the city, would not only trigger some flexibility on some of the things Mr. Gorman was talking about, but also would, maybe re-implement some of the things that the state public health officials had planned for and had the ability to do, a year or more ago when that happened. Is anybody on any of the hospital systems here, is anybody asking specifically for either a municipal or state declaration of emergency? It sounds like a resounding yes.
Trace, I would say that so when our schedules allow, we have a weekly standing call with Interim Commissioner Keith Reed, and that is something that we've begun to raise in the last week or so. Obviously, we all want to understand clearly what declaring the state of emergency would change, would afford us, would give us access to that we don't have now. So what I would say to that is that those conversations are being resurrected. Again, we're kind of in the frying pan and certainly trying to fight the fire while we're trying to figure out what kind of policies we could all use. So I would say that conversation is being resurrected to see if that lever were pulled, going to help us here get through what we believe is likely a couple of more weeks of cases increasing, hopefully a little less. No one knows, and then we're not sure about the decline. So I appreciate you bringing that up. I would say those are conversations that we're having.
Thank you so much, Dr. Watson. Anybody else?
I'll go ahead and move on. Casey McClung, you had a question?
Hi, yes, thank you for taking questions. In the beginning remarks, it was mentioned that there's been a shortage of basic supplies, of things like saline. Can you talk a little bit more about the supply shortages and how that's affecting patient care? And also, has this been an issue for hospitals before during the pandemic?
So I can start, and then I certainly will turn it over to my colleagues. There are a number of ways that we in the US, probably the world, are experiencing supply chain shortages. We know that one of our major sources of saline bags is, I believe, Puerto Rico. And there are multiple reasons why we go in and out of bottlenecks there. We have also had supply shortages of syringes, of flushes. I think we drew up 7,000 flushes on our, just creating them, which is what we use to flush IVs and et cetera. And so, yes, we've confronted supply shortages in the past. I would say, though, I think we've just been living with a global supply chain slowdown. And so, again, we've escalated these concerns. Thankfully, right now, we don't have a supply shortage of PPE. And we hope that that holds true. But when our numbers are outpacing our ability to care for patients, it makes even sort of what we've become accustomed to in supply chain difficulties even more difficult. So imagine being a nurse and you go to grab a bag of saline and it's not there, or you need a saline flush and you have to stop what you're doing to go draw it up, or you're not sure where the gowns are. Beyond just not having it, it's just one more layer of complexity and frustration and exhaustion that it adds to our workforce.
Julie, that was a good answer. I think it's a good question as well, Cassie. One of the areas that I would point out where we have scarcity that's frustrating is there are agents that we know have anti-COVID effect for patients, the monoclonal antibodies and some of the newly released oral agents. The scarcity with those is a frustration that we are all feeling every day. Every day we hear about or see patients that would be eligible and they have to get into a queue to actually be assigned to those therapies. And that's despite our best efforts to procure those. And as mentioned earlier, we're working closely with the State Health Department to make sure that we have access to those and we're allocating them in a balanced and fair manner. It's still, there's just not enough.
For sake of time, I'm going to turn it over for one last question. Corey Jones, you had a question?
Yes, thank you. I appreciate it. I'm with the Tulsa World in Tulsa, so my question's a little bit more geared that way. But hearing Dr. Bratzler discuss how a rural physician had been on a phone with 5 different hospitals in 5 different states trying to find a transfer, I'm curious, are any of the Oklahoma City hospitals sending patients toward Tulsa, or is Tulsa every bit as full as you all are, and any transfers might be going out of state? I'm just curious what you all might know about that.
So I know this particular physician did call Tulsa, all the hospitals, and couldn't find a bed for the patient across Oklahoma and went to other states looking for a bed. I just think that's becoming increasingly common. I was on a call earlier today with a municipality where they're having the same problem, finding places to send the patients for services that they just simply don't provide in their community. Things like dialysis, things like advanced ventilator techniques and other things that often happen for the COVID patients, or other complications that occur because of the disease. So Tulsa isn't immune for this by any means, Corey, and I think I suspect that if you talk to most of the hospitals in Tulsa, they too are very, very short of beds right now.
Corey,
go ahead.
I can answer for Integris Health. We, because we do have hospitals in Miami and Grove and Enid, daily we evaluate, is it possible to move patients that are holding in our ERs to those facilities? There really is no ICU margin whatsoever anywhere that I'm aware of. And dialysis absolutely is a regional crisis right now. It is horrifying, actually, the number of patients that are in desperate need. And we frankly, we may be able to get machines. That doesn't mean that we have the staff that know how to run them. And our alternative requires an ICU level of care if we don't have dialysis machines. So yes, it is dire. It is dire across the state. But I believe we all do everything we can to move patients wherever there is an open bed and the right care team to get them there.
And I would just make the extra point that the vast majority of us, if not all of us, have transfer centers, and the mission of those transfer centers is not to just simply say, no, we don't have the bed space. And oftentimes we're working with these outside facilities, trying to help them and provide a resource for them to identify other places where they might have room to accept a patient, even if it means transferring that patient out of state. So it's definitely a service-oriented process when it comes to requesting a transfer and trying to find a transfer destination for any patient. And it's challenging, you know, reaching into parts of southern Kansas, western Arkansas, northern Texas. All those places are dealing with an equal amount of struggle when it comes to bed capacity.
Thank you.
Thank you. That's all the time that we have for now. I want to thank all of you for joining us today and for helping us to share this message with our communities.
Thank you for your time.
Thank you.